God, who is always by my side. A very big God, by my side, by my side. The chairman of the occasion, Professor Bat Nudge, the great man that is performing wonders in Abia State. Ably represented by Sidon Adenova, former Commissioner of Information, Anambra State.
You're welcome.
His Royal Highness, you will soon be with us. Igwe Emmanuel Igwe, you will soon be with us. We are expecting the representative of the First Lady, she will soon be here, I think. Yes, the Vice Chancellor of this great university, Godfrey Okoye University. Reverend Father, Professor Christian Anyeke, the Vice Chancellor, who also happens to be National President, the Vice Chancellor. Yes, distinguished ladies and gentlemen, the Reverend Sisters, gentlemen of the press, Good. Incidentally, I am not a medic, first of all. Today, April 13, 2024. Incidentally, I'm not a medical doctor, nor am I a psychologist, but I am a mother that is interested in having this organization in Nigeria. Sorry about that. I am interested in establishing primary mental health care in Nigeria. Mental health is as old from the Garden of Eden, the shame felt by Cain when his sacrifice was not accepted led to the feeling of rejection, which probably led to anger, depression, feeling of loneliness, and led to killing of his brother Abel. When we talk of mental health, we consider our emotional, psychological, and social well-being. This has to do with how we think, feel, and even act. How do we relate with our fellow human beings? How do we handle stress and chaos we live in life? Mental health is known in every culture, society, religion, and institution that make up this fabric of the nation. But it is either switched away, rationalized, and are not treated, which has been the bane of the collapse of the nitty-gritty of families, establishments, and many of the ills in the society. Mental health illness are most times not visible in the eyes. Taking care of our mental health is very important in every stage of our life, from childhood to adulthood. most times we are not comfortable to discuss it, to talk about it, because of the stigma associated with it in our country. It is, however, important to understand and add clauses and take the correct advice on each occasion, which may be in form of counseling or medication. A person with good mental health invariably has a good physical health, which would lead to productive life in the family, in his own, in the family, in his or her workplace, in community, and wider society at large. Our mental health may sometimes change from time to time. This may depend on many, this may depend on many factors like financial hardship, caring for a loved one, losing a loved one, working long hours, and even childbirth. So we need to be mindful and make out time to celebrate any little win. A nation where majority of the citizens have poor mental health will invariably lead to several problems which the government may find difficult to solve. Mental health awareness and support should begin in the families, just as children pick up healthy lifestyles from parents, the same way possibly bad mental health lifestyle are picked up from cradle. Parents should work to make the family a safe and supportive environment for children to grow and flourish with good mental health support. Parents are the first psychologists for their children, guiding them through tender stage of infancy, childhood, teenage life, and early adulthood before they move out to have families of their own. If this is gotten right at the family microsphere, then love and respect should be promoted in family. It is my hope that after this seminar, all of us here will go back to our families, social circles, and be advocates for good mental health. From programs drawn out for this event and the speakers who are gurus in their various disciplines, we will learn a lot to reduce mental health problems in our society. Certainly, there is light at the end of the tunnel. Thank you, and God bless.
Thank you so much.